Usually this time is for the office hour. That means it's an open call where anybody can call in and meet with the secretariat, s- tell us whatever they want to tell us, ask us whatever questions that they may want to ask us. And we also seize the time to also ask questions from the members about what we are doing. And we've recorded some significant success over the past few months that we started this initiative. We've had colleagues join us from different places, from Sudan, Jordan, from Nepal, from Nigeria, from Ghana, from Uganda, from Kenya, and all the other different countries. One significant thing that had evolved that we did not plan while we're thinking through this initiative was the fact that we have actually used the time to deliberate on technical issues. So colleagues will just come on the call and raise technical issues that they are actually facing in their domain. And other colleagues on the call, we attempt to solve it. There was a particular one that we couldn't solve on the call that day, and we had to wait till next week and bring some other experts on the call to solve the problem. Some of them we are still chasing the solution. Up to now, we have not solved them because we have had to send a mail to two other organizations to come and see how we can resolve. Some of them took us to Global Fund, to Crown Agent, and unfortunately, Crown Agent closed down on us. But we are here this afternoon now, on the note that we want to take advantage of this call to address a particular trend within our ecosystem. You will notice that we had started nudging us around localization and regionalization from the beginning of this month. And we have had a couple of posts to suggest what has worked somewhere else. And there are a couple of questions that have been asked on the list set. So this is one piece that we are using to connect the trend with our current team. You know, just about the time we started the discussion, the World Health Organization and the Africa CDC also declared Mpox as a public health emergency. This is not the first time it's happening, so it's reimagined again. So we felt like we should also bring this to the fore. And I was also reading an article, and it's talking about how Mpox is also affecting the supply chain. We had learned from COVID and how it affected our supply chain. Before it takes a toll on the supply chain, let us also come together and learn what can we leverage to take advantage of the situation, or go ahead of the situation and nip the situation at the board. So that's what the call is about. Like, spontaneous call does not come with any formalities, but I just have to build this background so that I can bring everybody to the same table, and then we'll dive in and share our experiences. Um, the usual way I would want to begin is to just ask a couple of us how we are feeling about the Mpox. Different countries. I don't know how many countries that are here. If you are here, can you just type which country you are calling in from so that I can know who to direct to particularly. But if you also have any experience with Mpox, emergencies like COVID in the past, you may just want to take the next 2 minutes to tell us what your experiences have been. The floor is open. Yes, I have Kevin. I have Dr. Professor Chimeze here. Those are they are part of the experts that we pulled together to help us think through localization and regionalization throughout this month. So they are here to support me. If you have a question too, they will also help us to answer the question. Professor Dr. Usman Hassan, Head of Department Public Health, National University of Medical Sciences in Pakistan. It's good to have you. How are you, Professor Usman? And Jimmy from South Sudan. Jimmy, it's good to see you again. Oh, you're in Uganda today. That's good. Okay.
Thank you very
While
much.
yes, yes, someone is speaking. You can have the floor.
Hello, everyone. I'm Dr. Usma Hassan from National University of Medical Sciences, Pakistan.
Hi, Dr. Uzma. It's good to see you.
Good to see everyone.
Yeah.
Hello,
So,
everyone. This is Chime. Sorry.
yeah, Professor
Hello.
Chimeze, it's good to see you.
Yes, I will be off for a few minutes and come back. I just want to say hello. I'll join you guys in like 5 minutes or so, just to say hello. Thank you so much,
Okay.
everybody. I'm here. Thank you.
Okay.
Bye.
Thank you. Thank you very much. Okay. All right. So let's dig in. Mpox, what do we know about Mpox? How does it affect logistics? What does localization have to do with Mpox? Or how does Mpox help us to think around localization or regionalization, especially learning from what has happened in the recent past with COVID and how it affected uh, movements, logistics, and even vaccine and other health commodities availability within the continent of Africa and other continents. So let's dig in. What do we know about COVID? About Mpox currently. Maybe you can feel free to just unmute and interrupt me. It's an allowable interruption. You can interrupt me and then I'll give you the floor. Uh, yes, just to be sure. If you don't want to do that, you can also raise your hand and I can take note and give you the floor. But the much we know about Mpox, we know that it's zoonotic. That means it's usually transferred through uh, animals. And then I was reading earlier in the week how it's more affiliated, I mean closely related to exotic animals, maybe like people taking care of horses or maybe cats that people use as pets, and then they now move around to another place. Usually they stay in a particular part of the city, and then they take care of the zoo or the pets in another part of the city, and they have to commute and then get to their places. So there are potential contacts either with other people, and then the potential transmission happens. That is part of the things that I know about Mpox, that it's transmitted through contacts. And initially, earlier last week, we were thinking about technology. How does even technology help us to circumvent these issues around contacts? Is there anything that we can use technology to do to reduce the contact that we have with people and potential transmission? Was reading from Africa CDC, and the issue of the diagnostic logistic is also a big issue. How to get diagnostics across to where it's needed to make samples, and also transfer the samples to where the samples need to be analyzed and diagnosis be made happen. So these are the things that I know in the meantime. Earlier, I have gotten the interest of some experts to share their experiences in Sudan, in Zambia, and in Zimbabwe, but I've not They are not yet on this call. So anyone, please, the floor is open. Kevin, do you want to, do you permit me to put you on the spot?
Sure, happy to to help, kind of jump into this a little bit. I mean, one of the things that we have to think about with any pandemic certainly is preparedness. And when you think about preparedness, that really is a logistics. I mean, it's all supply chain. How can we quickly get the vaccines in this case, or the product from manufacturer into the field and deploy that as quickly as possible and as efficiently and effectively as possible. So COVID really taught us a lot of lessons, and I'm really kind of speaking from the Gavi perspective here, somewhat from the UNICEF. I'm a consultant to both. But from Gavi's perspective, certainly COVID taught us a lot. It taught us a lot about, first of all, the shortcomings that are out there, but we also learned a lot of lessons from it. And so what you're seeing now with Mpox and the response to Mpox is really heavily reliant on the lessons that we learned during COVID and COVAX. And so Gavi has been monitoring the Mpox outbreaks around Africa and other parts of the world really since 2022. And because there was the recognition that, future pandemics would be inevitable, one of the things that the Gavi board approved just this past June, when thinking ahead to the next replenishment period, is how do you prepare? How can we become better prepared for the next pandemic? And so Gavi's taken several measures, but one of those measures is simply called the 0-day financing. And that is a close to $500 million fund that has been set aside to respond literally on 0-day, to really cut that time down from the recognition of an outbreak to being able to have vaccines and immunization programs in the field. So that's a big step forward in preparedness. Now, one of the things we have a great advantage for right now is that Mpox already has a vaccine. We don't have to wait for the development of one, much like we did, with COVID. So right now, you've got vaccines that are available. We've got funding that's available. There's activities really from the conversations I've had, really the activities right now are limited to the DRC, the Congo, and their surrounding areas. However, it stands ready to leverage these funds wherever other outbreaks are. So I think the biggest thing that we can do, and when you think, certainly from a logistics, and I'm going to try to tie this back, Timmy, to the localization and regionalization topic that's IAPHL's conversation topic for August. And the other thing, and where I'm trying to tie this in is, the manufacturers still aren't on the continent. We've got to get vaccine manufacturing in Africa. And we have to do that for a number of reasons. First of all, for autonomy and being able to control the supply. You've got the demand, so it's time for countries to be able to control some of the demand as well. Some of the supply. You've got the demand, you need the supply. But also, it just shortens that supply chain. Right now, everything's having to come from Europe, some coming from Asia, and others coming from the Americas. And so it's long past time to get vaccine manufacturing on the continent and that will help as well. So Timmy, that's kind of my opening comments. I was telling Natty at the beginning, I unfortunately have a conflict at the bottom of the hour, so I'm only here with you for about 10 more minutes. Over.
Yes. And while we have you, we're going to take the maximum advantage of your presence. So thank you very much for that opening statement, Kevin. And you already have a follow-on question that I think you may want to answer. Are these vaccines available in every African country? That is coming from Jimmy from Sudan, Uganda. Do you want to respond to it immediately?
Yeah, so Jimmy, what I can say is the funds are there. It is the responsibility of the government to apply, for those funds. And of course there are, this is a rapid response. So, well, first of all, not every African country is a Gavi supported African country. So that would be the first criteria is, are you a Gavi supported country? And then if you are, it's a responsibility of the country to reach out and apply for those grants. And you would do that obviously through the country programs team that your country works with, daily. So that would be my response to that. Over.
Thank you. Thank you, Kevin. Yes. While we may wait for other people to ask, I have a question for you, Kevin. I know that you are very much involved with the use of technology to enhance access. So, and I was just wondering if from your experience, we have any chance to leverage technology to enhance both access or surveillance or even diagnosis in this case. Does it have any advantage per se?
So what I find interesting, so when you say technology, technology is a pretty broad category. And, so it could be everything from, digital, electronic records, all of that, all the way up to, drones, for example. And what's interesting when you think of technology and when you think of drones in transportation is, there are several countries within Africa and throughout the world that are now really ramping up and having fairly sophisticated drone programs that can really aid in this rapid response to any outbreak anywhere. I always like to, point to countries like Rwanda. Even though it's a small country, they're now in a position where they can get treatments to any one of their citizens within a half an hour. They've got enough drone coverage within that country that they can reach everybody within a half an hour. So that's pretty amazing. But then you think, more to how do you track and trace? How do you, how do you use data, and how do you turn data into information? And of course, we could talk endlessly about that, but that is kind of the next area that we need to. And that was one of the problems that we had with COVID. It became easy to get the vaccines into the country. But then the disbursement and the use of it became very difficult just due to the lack of really the infrastructure that we had in a lot of places. So yeah, Timmy, the more we can do with technology, the better. I can tell you that, Gavi 6.0, digitalization of the immunization and health system is a top priority. We're looking at machine learning, we're looking at AI and a few other things to help us, certainly around the predictive ability in many cases, as well as, the follow-up and the track and trace pieces. I hope that answered your question. Over.
Thank you very much. You did very much answer the question. I really appreciate. There's a question again. Do you still have 1 or 2 minutes? Okay. Manufacturing vaccines is costly. How does global investment like investors like Gavi support Africa in manufacturing vaccines to minimize the cost of importing from Europe
Yeah,
and Asia?
so again, another conversation that we could have, that would take some time. I would encourage your audience here to go to gavi.org and take a look at the investment case and take a look at, the resources that will be dedicated in the next 5 years. There's I believe, close to $1 billion that are going to be invested into regional manufacturing in Africa for vaccines. So there's case studies there. There's the business case there. You can read all about it. I really, unfortunately, don't have time to go into it. But there is a mechanism separate, and I will say this: it's a mechanism that is separate from the Gavi's replenishment. So there's two efforts going on right now. There's the replenishment for Gavi to keep traditional Gavi going forward, 2026 to 2030. But there's this separate mechanism around, piloting and in bringing vaccine manufacturing to Africa.
Thank you. Thank you, Kevin. We are glad that you were able to give us the few minutes that you have, and it's been super efficiently used by our team. Thank you so much. We wish you the very best in the next
I have
call.
a question.
Oh, she's got a question real quick.
Okay.
I've got 2 minutes.
All right.
I'll
Yes.
take only 1 minute. Thank you very much for the excellent comments and a very professional talk on your concerned topic. I'm really grateful. I will be only taking 1 minute. Being a public health professional, I would like to know the different preventive measures which are different from the last year monkeypox epidemic around the world. Are the public health preventive measures different this year? Secondly, is the strain more dangerous of monkeypox this year as compared to the last year epidemic all over globally? Thank you.
So, Timmy, and thank you for that question. I don't know. I have no idea. I can talk from the logistics perspective and a supply chain perspective. What I do know is that we've got measures in place now that we learned from COVID to respond quicker and better. But as to whether the Mpox strain is different, I'm not an epidemiologist or anything like that, so I can't comment to that, unfortunately.
Yeah.
Thank you.
Thank you, Kevin. Thank you, Kevin. Yeah.
Thanks, everybody. I wish you the best.
Right.
And you've got
Thank
another,
you.
you've got Jacob on here now. You can,
Oh, yeah.
and the
Oh, yes.
professor. Y'all can pick their brains now. I appreciate everybody. Sorry.
Thank you.
Sorry.
Thank you,
Thank you.
Kevin. Thank you.
Cheers.
Thank you. Thank you.
Bye-bye.
All right. So, Professor Usman, I read, of course, I'm not an epidemiologist myself, but I read that there are newer strains now that are evolving that are different from the 2022 epidemics that broke out for Mpox. So I cannot tell the level of virulence, but I know there are newer strains. We can find out. And then I know I saw somebody that could know on this call, but I don't know if he's disposed. The PHC EOC, Bayelsa State. Inera Mark, do you want to dig in? If you are not disposed, it's fine. Okay.
Thank you.
But while we are waiting, I think it's something that is what this call is about. We may not have the answers immediately, but we can have a pointer to what the answers could be, and we take it away and return it back to us as answers. So, Prof, it's over to you.
Thank you so much.
Right. Okay, so any other person on the call can feel free to give us a lift on the question. In your experience, what is the level of virulence of this current outbreak? Then as part of that, I also want to just prod us more. As logistics experts, one of my professors in school will say, if you are taking care of a person, you need to take care of yourself so that you can take care of the person. You get it? So if we are logistics experts and we're trying to make sure that people have access to commodities and all, how aware are we around the different preventive measure that we need to take, the prevention and control measure that we need to take? What are the things that we need to do to make sure that we are also safe? Because I also know we get to the last mile around this thing. Does anybody want to take a stab on that? Professor Chimeze would have had an idea of some of the things that was asked before, but he is not back on this call. I was hoping to ask him some of the things Africa CDC might be doing at this point to help take care of the pandemic. Okay. Any other question from us, or any thoughts? You want to share anything about the pandemic? I really like the idea of the questions around manufacturing in Africa, because the much that we know, we feel like if we manufacture close to where the pandemic is happening or the epidemic is happening, you can easily the logistics of getting vaccines across becomes better and more efficient. Yes, Mohammed, are you here? Mohammed, one of the things I read
Yeah,
through.
good morning, everyone.
Yes, good morning, Mohammed. You can go ahead if you want to speak. Okay. I was trying to say that one of the things I read about the monkeypox is the fact that the vaccine is actually part of the post-exposure prophylaxis. I found that very interesting, positively interesting. Usually, when you have been infected with some virus, it will be said that you should not go ahead with the vaccine. You should be tested negative before you vaccinate. But in this case, it seems a bit different. Has anybody come across that? Our team from Sudan, do we have any case of Mpox? Okay, so like I said, you can feel free to interrupt me at any time, and I will yield the floor to you. Additional thoughts is around the topic of discussion for this month around regionalization and localization. Okay. Okay, I doubt has been okay. Okay, so around regionalization and localization, that has become a very important topic in the development world, because funders and governments are beginning to think that we are better off bringing money into the country and then making the implementation of activities or the intervention happen by the country, by the experts within the country and all of that. So I'm wondering if any of us has any experience that you want to share with us, or any questions that we want us to dig in together. this is also an opportunity for us to do that. Now, I wish I have a music that I can play to you so that you guys can enjoy the music while you think. But I do not have a music, except that Nati is also an artist. Nati,
Should I take my guitar to play?
your guitar is not close by to you.
Yes.
All right. Okay. Uh, all right, people. So yes, I think we have done some justice to the topic, to the spontaneous call. We are still free. We are still here for the next 20 minutes or so. And part of the reason why we have this time is also to talk about various things. Okay, I have somebody trying to talk. Who was that? Did you get that person, Natty? Okay. If you're trying to talk, please go ahead and speak. Okay. So I was trying to say that part of the essence of this time is for us to be here and also talk about just any other thing. And any other thing can also include technical issues that you are dealing with at your work and non-technical things, because beyond trying to find solution to all of our technical problems or challenges, we are also trying to create this space as a safe space for us to connect. So it may not necessarily be technical issues, but you could just want to talk about something else. Feel free to take the floor and speak. There was a time we talked about, okay, the week after the Olympics, we also talked about the Olympics here and how Ethiopians stole the day for us for the tournaments, for the marathon. Okay, any other person, please feel free to come in. Okay. I'll give the next 1 minute and then we can collectively decide on what to do with the next 20 minutes. The chair of the council. The chair of the council. Are you here with us?
Maybe I'm here. I'm just
Okay.
learning and also getting bits and pieces of the information being shared across. So, for us, as logistics, expert, we're always looking at the impact of what is happening on our logistics in terms of availability, how these things can be mobilized within the shortest possible time to intervene and ensure that this, disease doesn't cause so much havoc. So I think we are monitoring, and it's all about resources, both financial and human resource, trying to look at where the lapses are and then maybe fill those gaps. Like Radley pointed, this is something that, from where I sit, we don't really have a case, an incident here. So I'm also monitoring and learning from what is happening out there. But as you know, for us in Ghana, we built the resilience over time because you see, what's the Ebola and others caused a scare some time back, and then so we put in some systems. So it wasn't surprising that when COVID was biting hard, we were really not so much affected in terms of our interventions and the systems that we're able to use to manage these things. So we are monitoring the issues and then also have put in the systems, just waiting. We are praying that we don't have a case here, but it is not far from us. When COVID started in Wuhan, nobody expected that it would get to us. And then in a matter of months or two, then the whole world was really. So we've learned lessons from COVID, and that should guide what we are doing currently as far as this Mpox issue is concerned. And for me, the useful lessons from COVID should be, this is a test case for us to really see whether we have built that resilience and actually reset ourselves for the next waves of any pandemic that may come. So this should be something that we have to now understand whether the systems we have built over time, the various capacity building initiatives we've done over time, are they working? This is a litmus test for that particular situation. So this is what I can share with the team. Thank you, Nova.
Thank you, the chair. I appreciate that. Yes, I like the idea that it's a resilient system had been built in Ghana, and then we are hoping that that system can withstand whatever pressure or shock that may come, and we also pray that it doesn't spread. Right? I was in the commentary or the declaration I read from the Africa CDC. They made the note that for now, there are no restrictions on movements yet. And the word that stood out for me was yet. So, all right, thank you, the chair. I appreciate your time. So, yet. So I was just
Yes,
wondering.
thank you. So I'll connect later to align if there are any issues that I need to know. So take care, and I wish everyone the very best of the
All right, thank you,
discussions.
chair. Thank you.
Thank you.
Yeah. Yeah. Thank you, Jimmy. Okay. James, your internet is poor, but you can feel free to drop your message if you want to either ask a question or speak to any of the issues. I read from Jimmy, resilience versus efficiency is equals to balance. Okay, fantastic. Okay. Yes. James Ball, the discussion has been very insightful. We've learned a couple of things. Part of what we have learned is around the fact that vaccine is available for Mpox. We agree that local manufacturing will have been the best, though we do not yet have it. So the vaccine that is used for Mpox in Africa is actually imported. And then how Gavi has also generously supported some both procurement and beyond that localization to see how vaccines can be manufactured within Africa. I had called on you earlier in case you have any thought from South Sudan. It may be good to share with us. So you have the floor now if you have any if you want to share anything. James. Okay.
Yes, good afternoon.
Yeah, good afternoon, James. It's good to have you.
This is James from South Sudan. Hopefully, we are also preparing for this emergency Mpox. We even also collected some of the sample which also came up negative, but we're still preparing for any emergency or any cases that might be reported. We have a daily call for any report, especially when there are cases identified in our area, especially on this at the state, which is district and other contexts. So we are also monitoring the situation. That's why also we are also aware of the situation, as this is a public emergency for all African continent. Over from my side.
Thank you. Thank you very much. I appreciate that update. So that means we South Sudan is still relatively safe from the spread currently. Thank you. I'm just checking if you have anybody from DRC. Unfortunately, I did not see from the chat that anybody is from DRC. It would have been good to hear what's happening from the Central Africa region precisely to see what we should look out for, what can be prevented. For COVID, one of the things that was affected and scarily so was the treatment of other chronic conditions or other infectious conditions like the TB and HIV. And I'm just hoping that with what we have learned and how the strategy we had deployed during the COVID pandemic can still be either brought to forward or sustained to circumvent potential disruption in other services at this time. Okay, we have just about 12 minutes to the top of the hour. Okay, Kenneth from UNICEF. Great to have you. Great to have you. Feel free to jump on the conversation. We are talking about COVID, logistics, and localization. What are the implications? Sorry, not COVID, Mpox, localization, and logistics. What are the interconnection? What are the relationships? So Kevin, you can feel free to talk to us if you have the chance and time. Okay, so beyond Mpox 2, I'm also asking, because this time is doubling as a spontaneous call and office hour too. So maybe in the next 10 minutes, if any of us have anything to share with IHPHL, what we are doing, what do you think we are doing that we need to do better? What is the thing that you think you have enjoyed in IHPHL that you think we should put more effort in? Or is there anything that we are not doing that we don't even know that we are not doing that I want to bring to us? This time is a good time for us to bring that to us. It's a good time for feedback for us. And then it doesn't matter what the feedback is. There are some feedback that we had been able to implement. There are some that we had not been able to implement, either because we do not have the capacity to implement it or because it's not within the jurisdiction. One of the questions that we have had over this call is, why is IHPHL not offering a training of its own? And we explained around our members are trainers and we don't want to compete directly with our members. So we'd rather have James, Kevin do training and advertise on the platform rather than we doing training and then competing with James and Kevin and Kenneth. And another question that had come is around how we can badge membership on the IHPHL, that if you have been a member of IHPHL Are there no way we can rank the membership such that if depending on my level of expertise or my level of contribution to the ecosystem, we can give you a 3-star, 2-star, 5-star, and the likes. We are still thinking about it, but in the meantime, we have not implemented it because we do not know exactly how to implement it. That's just point blank. So those are the kind of things that come up. And I just want to encourage you to feel free, even if you feel it is too grandiose for us to implement, feel free to still share with us. You might just be the key to our next level as an organization. Okay. I am checking. If I see anybody with a raised hand, I'll give the floor. And we were just talking about my background. I hope it's still there. Yes. Natty, is your background still there? Yes, it's
Normally,
still there.
it's still there.
Okay. So we're just talking about my background and Natty's background. Unfortunately, Jacob had left. So these are two different backgrounds, but they both belong to IAPHL. These usually appear either on a call like this, on our banner, backdrop banner, or on our business card. So your opinion about this is still very important. How do you see them? What does it mean to you? Which one would you prefer if you have to choose one? Those are also kind of conversation that you can bring here, or later you can just reach us privately and say, yes, I think this one behind you does not look so good. You can do this or that. Dr. Uzma, are you still here? Dr. Uzma, I wanted to ask if you know our chapter leader in Pakistan. Okay, I will give us back 5 minutes so that I can let us go. I want to say thank you very much for joining on this call today. The essence was for us to raise the issue around Mpox centrally, and then connect how our work as logisticians affects or is affected by Mpox, and then consider some broader implication on localization. How does it help us to position our thinking around what localization is, what the benefits might be, how should we go around localizing or regionalizing our logistics or our supply chain? And I think with the different contributions that we've had today, we have better understanding of what Mpox is, what are the potential opportunities we have to manage Mpox or treat Mpox, and how it affects our logistics. We cannot boast that we are done exhaustively to the conversation. The major point is to nudge you further to learn more about Mpox, and then think about how it affects your logistics or your supply chain, the work that you do. and also think about how you can use the work that you do to affect the Mpox spread, either to contain it, see how your work can possibly spread it and contain that. Then beyond that, localization. I like the questions that we have asked about manufacturing. If vaccines are still moved across different continents or across the ocean to get to Africa, where Mpox is majorly an issue, then it suggests that there are some potential possibilities to build in efficiency within the supply chain by bringing the manufacturing, making the manufacturing of such vaccines to happen in Africa. So what can we do as experts? What are our contributions to this? We are just pouring us and trying to prod us more to think about these things. You are an expert in your own right, and you have a direct first-hand field experience that can be used as a very good resource to enhance the policies around what needs to be as part of localization or not. And as part of surveillance management of Mpox, you also have a contribution to make. On that note, I want to say thank you again for joining us on this call. The recording will be made available to all of us, where we can still listen, think about the things that we talked about, and think about the things that we did not talk about, probe further, and then also reach back to us with questions. I want to really appreciate you all. Okay, and that is going to be the end. I wanted to give you 5 minutes. I eventually ended up with just giving you 2 minutes back. So thank you. It's officially the end of this call. Thank you, everyone. You can unmute and just say bye to your friend.
Thank you. Bye.
Thank you.
Bye.
Thank you, James. Thank you, James. Bye.
Thank you. Thank you, Timmy. Thank you.